Okay, so today I'm joined by James Dixon, who is Associate Director, Sustainability at Newcastle Hospitals Trust. Welcome, James.
Hi, Gareth. Hi, everyone.
Thanks for joining me. So, in 2019, Newcastle Hospitals Trust made the headlines by becoming the first healthcare organisation in the world to declare a climate emergency. Now, we're going to get to the story behind that in a moment, because James is behind that. But first, I'd like to go back to the beginning and ask James, why did you first get involved in sustainability?
Well, I've always been interested in just outdoors. So I'm from rural Northumberland, a little bit further north here where I'm based now in Newcastle. So always like the outdoors, fan of nature, spending time in that way. And then the subjects of school would just geography and biology that seemed to be of more interest to me. And I had no idea what I wanted to do. It got to, I picked the A levels that I liked, geography, biology, and computing, and blunderbust my UCAS forms, didn't know what degree I wanted. It was all at different universities as well. And then I met my now wife just before applying for university, so stayed local. So I went to Northumbria University in Newcastle. And the course that I was down for that was computing. And when I looked around and I saw the syllabus and other bits, I knew I'd made a mistake. So thankfully, in the first week, I switched and went over to geography and environmental management. And that was one of the best decisions I've ever made. So, and then did my degree and was trying to find a job in the environmental profession with no experience, naive lad from the sticks. And was lucky enough to have a bursary funded to do my MSc in Sunderland, so not too far, a bit further south from here. And then I knuckled in and did a workplace module and tried my very best to get experience. That got me a job at the city council. And so I was really, really lucky that just my interest and my studies were what I was, passionate about. And then I managed to get a career in that. All my friends and peers, were getting degrees and good qualifications, but they didn't really follow their passion, if you like. So
Yeah.
I do count myself really, really lucky. Yeah.
And did you find the content from your degree, was that immediately applicable to what you were doing in the job, or were you mainly learning in that job?
I think there was definitely the foundations. I was really lucky because I'd had that blip of applying for one course and then going across to a completely different department. At the time, my undergrad is actually environmental studies. Environmental management was the BSc that most people did. Environmental studies had a few more module options.
Hmm.
So I could do, sustainability for business or that kind of thing. So I did some of my modules in the business school, not just in the geography. So yes, I found some of that was really applicable. Again, really, really lucky with that. And the work placement module I had with my master's got me a placement at Newcastle City Council, doing environmental auditing and management systems.
And then did you move from the council to the hospitals trust, or was there intermediate steps?
Yes, no, it was I was in the council within their sustainability team, implement environmental management systems, so ISO 14001 and EMAS that some people might be aware of. But also I was poacher and gamekeeper, so I
Mhm.
was auditing other people's systems that they were implementing across the council, but I was also implementing systems in areas that I wasn't auditing, if that makes
Yeah.
sense. But it was a great foundation because I would be assessing the environmental impact of the bin wagons or
Yeah.
the grounds maintenance team or Newcastle City Pool and the leisure centres. So really, really lucky that I could have that variety of sectors and kind of knowledge. And then I moved on within the council to go to one of their directorates. So I was with the highways, civil engineers, town planners, and I worked on their environmental management systems from within. So
Yeah.
yeah. And then I did move on to the hospitals. Yeah. Yeah.
Yeah.
From there.
So I mentioned it before, but this pioneering move in the Newcastle Hospitals Trust to declare a climate emergency. Can you can you tell us the story behind that?
Yeah. So I joined the hospitals in 2010. And like a lot of people, I was the lone environmental professional in the trust. I think we had about 15,000 staff at the time, but focused on waste audits, reductions, cost savings, recycling, sustainability strategy on the side, and the action plan and the governance and other bits and pieces. Recruited green champions, did some great projects, some grassroots. So that was all fantastic, but it was quite incremental and, like usual with business as usual, you're just trying to make marginal gains. And then we managed to get some bigger improvements when I recruited a team and established a bit of a brand. So Sustainable Healthcare in Newcastle, which we acronym to SHINE, give us a bit of an identity. And, the wider trust was starting to see, that's, how we link our work to some of the sustainable work that we do. So on all the recycling posters and other things and all our comms materials. So that was all great. And we were winning some awards for little projects. But in 2018, the IPCC report, so I'm sure all your watchers know what that acronym stands for, but Intergovernmental Panel on Climate Change is all the climate scientists coming together around the world. And their report in 2018 showed that we were basically on a precipice. There was the 1.5 degrees agreement in Paris that we were trying to limit global heating to. And at the time in 2018, there was a 50-50 chance of staying within that. That was the trajectory we had. Obviously, we know now that that chance is increasingly disappearing. But at the time, in 2018, I had young kids and I kind of felt complicit in the business as usual that I touched on earlier, that working within the system as environmentalists, passionate about reducing environmental harm, we weren't doing the transformational work that we needed. So that summer, and people will have their own timestamps around then. So Greta was starting her strikes that summer. Extinction Rebellion were doing their first kind of actions and demands of Parliament. And that winter, 2018-19, for me was really, really difficult. So like I say, we thought we were doing quite good things, but I just felt depressed. That winter, absolutely. So it was getting into early 2019 and I was gearing up to get arrested. I was getting trained with the Extinction Rebellion for non-violent civil disobedience, and taking part in some local actions here. We Gareth, you'll know the Corner House Junction, not far from where we live, really bad pollution hotspot. So a few local families, and we took our kids down to just basically protest on the side of the road there, and also in the centre of town, because there's about 200 excess deaths in the wider city region in Newcastle attributed to poor air quality. So nothing quite arrestable at that stage. And, my missus was getting a little bit worried about how we could pay the mortgage off. But I was still in that depression and she recognized that. Thankfully, she's a clinical psychologist. So she'd seen the signs, if you like, and could see it in us. I was quiet. People will recognize it. I was withdrawn, energy going, and just genuinely frightened for my kids' future, angry at, governments over many years have known that this was coming and they just continue down a terrible path. So it was a really, really difficult time. But what it did spur me into doing, thankfully, my wife pointed out that I could have influence. I absolutely didn't feel it at the time, but I heading up a small team of environmental professionals within a very big organization. It's an anchor organization in the city of Newcastle, and like a lot of big hospital trusts are. And my meager, I think I calculate it was about 8 tons a year of my personal carbon footprint. Then there is 50,000 tons attributed to our controllable emissions at the time at the hospitals. So, if I can turn that super tanker, I'm going to have more impact than me getting arrested and, going to plant trees and do pro bono work, which is the way I was going. So thankfully, I then approached my director at the time. I had a few other hats. So I was responsible for car park and asbestos fire, a willing horse, working with good professionals, but it was stretching us away from the work I wanted to do. and what I was passionate about. And it was fueling my anxiety and my fear, really. Well,
Yeah.
climate anxiety, eco anxiety that we know now. And he was really receptive to transitioning some of those other services to other people,
Yeah.
and allowed me to pull together a bit of a proposal to our executive team about stepping up our game. Now, that was great. I mean, try putting a one pager to an executive team about, why this is so important to planetary health
Yeah.
as well as human health. Very, very difficult. But I was up for the challenge. And it was about the time, so this was early 2019. Extinction Rebellion did their really big action in the April of that
Yeah.
year. And there were a lot of councils declaring climate emergencies about that time. There's a lot of early ones. So it became a bit of a hook, a bit of a thing that, this could be what we did. We would
Yeah.
declare that. Now, obviously, underneath that, we were saying how important it was to population health. If we don't attribute this, we're just going to have more people coming in through the front door. Why do we continue to burn fossil fuels as our primary source of heating? Can we transition away from that? Diesel vehicles and ambulances, surely we
Yeah.
can do a bit better than people breathing in that pollution and coming back through the front door. So, yeah, long story short, after that, I managed to get a good one pager forward, and the execs were intrigued. And there were challenges around affordability and deliverability, rightly so, and we were able to answer some of them. But some of the hooks that really, really landed were, we were under a new leadership team at the time. Dame Jackie Daniel, she's just moved on actually at the end of this year, last year, but she was new at the time, and trying to instill a bit of different culture and kind of partnership working with our other city institutions like the council and the universities, etc. So the fact that the council were looking to declare a climate emergency and the universities were considering it, that kind of said we should be joining our civic partners if it's a priority of theirs as well. And like I say, we'd been doing some good stuff, some good projects. The Shine brand was relatively well known. So I think the exec team had confidence that if we do this, if we do kind of put our heads above the parapet and, say how important it is, we've at least got a bit of a foundation to go from. So it was still a bit of a challenge. So it was on a knife edge. They hadn't agreed to declare. There was a lot of back and forward. And then when I thought it was almost slipping out of my grasp because of all these challenges, there was the final executive team meeting before the board was going to meet it was in June 2019. And my naivety at the time of governance arrangements at these hierarchical kind of organizations were that I would need to get approval from the execs and then go to board and get approval from them. But what I know now is that essentially if you have the CEO and all the executive team members on board, then you're pretty much gonna to manage to get it over the line.
Well, that was one of the number of things that I was going to pull out of that story, because I've heard the story before, which is why I asked you to tell it again, because I think it's so powerful. The fact that you used eco-anxiety, and due credit to Mrs. Dixon for her efforts in there, because it sounds like they were pivotal, but using eco-anxiety to raise your sights rather than continue down into despair. I think that's a fascinating lesson. The other one, which you alluded to there at the end, was the importance of getting that leadership sponsor on board, and how that can be influential as well as the peers, the other organizations in the city. If they're doing it, should we not be? So those are the three things I pulled out of the story you've just told us.
Yeah, and just to get back to the leadership bit, so I was really, really lucky, and I do think that a lot of the stars aligned. It was good timing. It was my drive at the time that I'd not long read Joanna Macy's book Act of Hope, which was part of that. Are you gonna sit there and essentially grieve for the planet and not do anything, or are you going to do something about it? What's within your sphere of influence? So that kind of drove us to do that. But it did feel like it was slipping away. And on the morning of the last proposal for the execs to agree to do this, I thought, well, the night before, what more could I do? So I'd been reading Greta Thunberg's little collection of speeches. You could get it for £3 from Waterstones, and I was reading that to the kids. And I thought, well, Dame Jackie likes a book. She's an example of empowered leadership. And so I could get that. £3's not going to be seen as a bribe. But shy lad from Northumberland, I wasn't going to give it to her. So I wrote a nice little note, and I thought I'd drop it off with her PA the next morning. And I drew attention to one of the quotes in there about cathedral thinking. So,
Yeah.
we've got to be brave. You've got to start the foundations, not quite knowing where you're going to get to, because essentially we are being a bit brave with this declaration. The NHS is a very politicized beast. For those not in the health sector, you'll know how cherished it is as an institution in the UK,
Yeah.
but it is very politicized. It is funded by taxpayers' money, and the direction of the politics at the time can change quite a bit from what you can do. So it was taking a risk, so I dropped it off with Dame Jackie's PA and then skedaddled, like I didn't have anything to do with it. And then I got an email later on, must have been around lunchtime after the execs had all finished, and it was from Dame Jackie, and it was saying, thank you so much, we approved it, with loads of exclamation marks.
Fantastic.
Now, I took that, with a pinch of salt, because I thought I had a load of work to do on, getting the rest of the board. Channel 4 News got wind of it. So Victoria McDonald, who I met, which was amazing, interviewed us and came and did that. And the chairman was getting interviewed the day before the board meeting, and I was off camera, and she said, well, what if you don't agree to do this? And he'd said to her before the interview, oh, it's fine. We've agreed chair's action. We've already agreed that this will happen. And I thought I was going to have to do the bloody presentation of my life. So that night was a lot less stressful, pulling together the few slides that I had for that. So yeah.
I should have said, actually, the fourth thing from the story was you linked the climate emergency to health. And obviously, the NHS has stated that it's one of the biggest, if not the biggest, health challenge going forward. So that's always something I find important in talking about sustainability and the climate in the health sector.
Yeah, and the Green NHS team have a good little tagline of healthier planet, healthier people. So we know that the determinants of health, apart from socioeconomic status, is essentially your environment. So the air that you breathe, the green space that you access, the food that you eat, etc. So it's so intrinsically linked. That's why it lands really well with the workforce. So societal expectation on action in this space has changed massively, even in the time that I'm talking about, with this non-violent civil disobedience rising. And don't waste time on climate change denial conversations anymore in the organization, which is very refreshing.
Yes, that's what I have spent far too much of my time arguing with climate change deniers. So, once the camera crews had packed up and gone, and the minutes had been approved and all the rest of it, what did declaring climate emergency actually mean in practice?
Well, we didn't actually know. So we went forward wanting to do that because all I wanted genuinely was for them to kind of understand the pain or the fear that I had and how important it was for health, as you've touched on earlier, Gareth. So I just wanted them to get it. And that, I don't know the answers. I don't know how we're going to fund this. I don't know how the hell we're going to turn this super tank around. But you just all need to know that this is really, really important to us, really important to society, important to our patients. And if we crack it, then the ill health burden on the country is going to be so much lower. So we kind of went into it, and there was an article that Dame Jackie did not long in the HSJ, and the one bit came out of it was we didn't have a 45-point plan ready to sign off and agree and crack this. So we were in uncharted waters, if you like. But what it did do was empower staff who were already kind of wanting to do work in the space to do that work.
Yeah.
Now, what did happen was the floodgates opened. So me and my little team got inundated by a load of more green champions wanting to do great stuff, which is welcomed. But then every other kind of sustainability professional in the NHS or the national team establishing their work wanted a piece of our action. And me being me, I welcomed that in and tried to accommodate it and, share it, because even as big as we are in the city in Newcastle as an anchor and an employer, and the NHS is as big as it is, the NHS is only 5% of global healthcare spend. So when you're talking about your embodied emissions, you need to create those ripples. So
Yeah.
that was, I didn't anticipate that. I didn't anticipate my inbox getting as crazy as that was. But it also, so it lifted up that empowerment. We had a strategy that we took a whole year to kind of think about after we declared. And it was really ambitious. Some bits now haven't stood the test of time as well. We thought we could do that. We can't. There's been a little pandemic in the middle of it all as well.
Yeah.
But I would say the main theme is just it empowered staff to act, and to
Yeah. Well, if I
change
could
things.
share an anecdote, if that's all right, because just about the time all this was going on, I suffered a hernia and ended up in the Royal Victoria Infirmary, one of the big hospitals that the trust covers. And when you're about to be wheeled into surgery, the anaesthetist always starts up a conversation while you're waiting. And she asked what I did. I explained it. And then she started talking about the different global warming potential of different anesthetic gases. And I was just I was so impressed that, just before a surgery was about to take place, when she's doing her job of making sure that I am both sedated properly and going to come back, that she was so fascinated by this. I'd love to know how the conversation ended, but I woke up in the recovery ward. But it was a real measure of how deeply the enthusiasm, I think, was felt within the trust.
Mm,
Uh,
yeah.
but in terms of targets, what targets came out of the declaration?
Yeah, so when we declared, it changed slightly. So we basically said that we wanted to be carbon neutral by
Yeah.
2040. And that was really just trying to align with some other partners and early stages. But what we honed that to be, testing what the
Yeah.
staff thought it was, align it with the science. We did some excellent work with the Tyndall Centre, who, a lot of people will know the climate scientists there, and Kevin Anderson, the professor there, is amazing. They essentially do a carbon budget on a place-based scale. So we were lucky enough to have a one for the city of Newcastle. And what we did with their help was essentially create a budget down to our organizational footprint, which hadn't been done before and was certainly the first in the NHS. So we knew how much carbon we could emit if we were to stick within 1.5 degrees. So we still have that budget and we measure against that. But also that showed that the lion's share of the work had to be sooner rather than later. So what we landed with was, and to use the NHS language, the NHS targets are the carbon emissions the NHS controls. There's going to be a net zero by 2040. So that's 10 years ahead of UK government. And for the emissions that the NHS influence, which is huge, it's about 70% on average, is by 2045. So still ahead of UK government. And we've gone more ambitious with that because we know if we're going to truly align with the Paris Agreement on the grandfathering kind of rights, we are net zero for the emissions we control 2030 and the ones we influence 2040. And that does align with Newcastle City Council, who are 2030 net zero, and Newcastle University, who are 2030 net zero as well. So the city of Newcastle is all aligned to achieving that.
Yeah, excellent. And the Tyndall Centre carbon budget, was that effectively a science-based target with a small SBT, because it's giving you that trajectory down to a 1.5 global warming? Yeah.
Yes, definitely. Not to the SBTI standard because that gets you into scope 3, but yes, essentially, and it's very much energy carbon only. So, when you do other carbon footprints, people are familiar, you tend to have carbon dioxide equivalents because you've got other greenhouse gases. This is purely on energy because it's measurable and relatively easy to work out in that space. And it is the carbon from energy over that time. So it is a carbon budget for our energy. But what we do to make it easier is essentially say all of the controllable emissions that we have, which we'll get onto around anesthetic gases and travel.
So I was going to ask whether my anesthetic gas was included in that.
It is.
Have there been any downsides to declaring a climate emergency? Is there any times where you wish that you'd done something a different way, or?
I think, well, on balance, no, it's, massively more positive than it is negative. But, the downsides are definitely you've put your head above the parapet so you can't get shot at. So, oh, you've declared a climate emergency, but oh, you've just opened a car park.
Yeah.
Those challenges then come, which,
Mm.
is totally fair enough. And also people just hold you on that pedestal. So they assume you've got it
Yeah.
cracked. So, Newcastle declared a climate emergency, they'll, surely have sorted all these things out. And why aren't you doing this or that?
Yeah.
And then staff, and the good negative, if you like, is because you've done that, you need to be acting in all these
Yeah.
spaces. And for a team that didn't, change fundamentally from before and after we declared, that we stretched ourselves too thin. So
Yeah.
we were very ambitious. We wanted the breadth of sustainability so wide. So that is possibly one downside, I would say.
Yeah. But I can see, you obviously took a brave decision to dive in at the deep end, and that meant you had to swim.
Yeah.
Whereas a lot of people are still sort of paddling at the shallow end and sort of wondering whether they should step a little bit further into deeper water.
There is.
Yeah.
But to use that analogy, there's been others that have slowly slipped into that deep end and got a lot of work done that haven't declared a climate emergency.
Yeah.
I'm aware of people that have really focused on their controllable emissions in the NHS and have done it without fanfare, So there's been some excellent stuff. We had thought it might have gone like local authorities, in that more people would declare climate emergency and then you'd have this wave of NHS doing that. But I think that was the pandemic kind of put a stop to that. And, rightly, people were kind of focusing on elsewhere.
Yeah. So, you've mentioned some of the obvious challenges. Healthcare is often literally a life and death decision. Sector, the NHS is huge. But day to day, what do you find that you're struggling with, or barriers that get in your way to what you're trying to achieve?
I think it's probably the same everywhere. It's, we haven't got enough time and capacity. We're a public service. We are you might consider us a consultancy, or an in-house, chartered professionals, trying to work on that. It's never as big as it should be. And then even if you manage to get other people on board, we're 18,000 staff now. They haven't got the time and the capacity and the funding. We're always competing for that. So it's time and money, like a lot of other places. But probably of our own making, we want to be a global leader in sustainable healthcare. We want to cover every aspect of it. The Shine program I touched on earlier, there's 8 elements to that.
Yeah.
So naturally you're going to have at least 8 projects on the go. Invariably, energy is just one of them. And that's, 80% of our controllable emissions is a big kind of city centre hospital, the heat and power. So you've got loads of projects going on there. So yeah, time, money, and just breadth of work that we're trying to do.
Yeah. Because we touched on the anesthetic gases before, and there's other issues like meter dose inhalers and things like that. It always struck me that healthcare has, as well as the usual heating buildings, lighting, and powering equipment, and moving stuff around, you've got these other challenges as well.
Yeah. We are small towns, if you like, the hospitals, these big hospitals that you see. So we still have the same challenges of a 24/7 service, that you've got to keep that ambient temperature. You've got lots of people coming in. You can't close the doors. So refurbishing to a low temperature heat network to make you ready for heat pumps or ground source heat or geothermal. The NHS doesn't have lots of extra space to decant a ward to be able to do that kind of work. So that is a unique challenge in healthcare compared to peers who I work with in higher education. The summer, the students go, you have a window where you can get in these places and get stuff done. So there's that challenge aside, but you're right. There's things in our controllable emissions, like anesthetic gases. Volatile anesthetic gases have high global warming potential. Your anaesthetist was probably mentioned desflurane, which is the bad boy of the volatile anesthetic gas. Very quick, very expensive, and you snap back out of it. But 2,500 or something times worse than carbon for every gram that gets emitted in the atmosphere. So work to kind of phase that out and use lower carbon anesthetics. We've been doing some great work. Well, the anesthetic teams have. We hosted the first UK Sustainable Anesthesia Fellow at Newcastle, doing work
Yeah.
across anesthetics from 2018. I think Kathy started, and then we've had a different one each year. So our clinicians have really stepped up to work on, caring for people and planet, if you
Yeah.
like. Yeah, and then another success that we've had. So we call it in the group of anesthetic gases, but there's analgesics as well, nitrous oxide and Entonox or laughing gas that
Yeah.
people might be aware of. So gas and air, pain
Yeah.
relief, giving birth. It's been used for 100 years. NICE guidance says that all birthing mums have to have it available if they want to
Yeah.
use it. So it's not going anywhere fast. So we knew that, and it's a big proportion of our controllable emissions in healthcare. And we couldn't do anything about it. But I'm part of a European network as well. There's an NGO called Healthcare Without Harm. I actually sit on their board of directors voluntarily in Europe. And we were aware within that network of Northern Europe, Scandinavia, a technology where they were taking this gas, and as it was exhaled by the users, they crack it into harmless nitrogen and oxygen. Now, nitrous oxide is nearly 300 times worse than
Yeah.
carbon as a greenhouse gas. So, and we use this in healthcare a lot. So it's a pain relieving gas. Yeah. But that technology, we were the first in the UK to adopt that. So there's if you punched into Ecosia, not Google, you'll see baby Rosie in Newcastle. She was the first baby born in the UK using that technology, so that essentially it was climate friendly pain relief.
It's not just being pioneers on declaring a climate emergency. You're pioneers actually taking some of these practical actions.
Yeah.
No, it's something to be very proud of. Okay, so looking back at what must have been a mad 4 or 5 years, particularly as you mentioned, we had the pandemic in the middle. What do you think are the most important lessons you've learned? What would you, if somebody was coming into your team, what advice, if you were sitting down and saying, look, this is what you need to do to get things done around here, what would you advise them?
Yeah, well, anyone coming into the NHS in a big organization like ours, the first bit of advice, and it's just don't get overwhelmed by it. And that's just the NHS and the size of the organization, because you tend to come in as a specialist, certainly in my team, you're doing a function and your expertise is there. But suddenly, you're on 2 huge hospital sites and, 18,000 staff, who deals with this and that? So it can be overwhelming. So that's definitely the first advice. But holistically, I would say probably just taking forward the opportunities that are presented to you. Yeah. So I'm lucky enough to have, taken on lots of roles outside the sphere of what a sustainability practitioner and a professional would do. So the hats I've worn is the responsible person water for the whole of the trust. So that's where Legionella control and other things are involved. Huge litigation risks. You're learning acronyms like HCAI, healthcare acquired infection. So huge risk. That said, nothing really to do with the work that I was doing, but I got really close with the engineers and the ops and engineering guys. So built that relationship with them, and also microbiologists and infection prevention control. So if you are not familiar with healthcare operations or in the NHS, this is like the health and safety, on acid. Infection prevention control in NHS are all about standard precautions and absolutely making sure that we do not put more harm to patients. So my relationship with them and microbiologists came about with that kind of work. So, and I still draw on that social capital, if you like, because if you have those allies, you can get more stuff done when you're trying to make changes that is always hard.
Yeah. So it's not just having allies on the board, which we've already covered as being really, really important and really useful, but having allies across the organization.
Yeah, to be just super connected, really. And I work on that. I'm just, if people reach out, I want to know what their role is. Certainly in the early days, I was feeling overwhelmed in the first few days when I landed in the NHS because there wasn't anyone to manage me. I was by myself, and so I just reached out. And the first waste audit I ever did was in mortuary. Lovely guy, the mortuary manager. He was going to have a human tissue authority audit, and he said, "Oh, I think we're supposed to have a waste audit too." And I just said, "Well, that's great, Jeff, but can I come down and just see what you do and learn about it?" And that was fascinating. So I would take every opportunity that presents itself to you, even if it feels a bit weird or outside
Yes.
your comfort zone. Definitely.
Yes, the dead center of the organization.
Absolutely. They come in one door, they go out the
Yeah,
other.
and the other networking you mentioned, of course, was the external networking as well,
Hmm.
because they is it Ecosia, the maternity gas and air recovery system. That was that commonplace overseas, or was it in one particular country had pioneered it and then you brought it into the UK?
Yeah, it was a well adopted for many years technology in Sweden. And there
Yeah,
was a couple of providers, and then it kind of moved into other Scandinavian countries, and I think they were working elsewhere. But it had really good footprint there. Um, the reason that came about in Sweden and other Scandinavia, I believe, is on the safety side. So another bit we didn't touch on, nitrous oxide as a control of substance hazardous to health, COSH. It has exposure limits. Now that's fine. But if you work in the industry, like a midwife, for example, and you're exposed to that in the room a lot,
yeah,
that's really bad for your health. It can have detrimental impacts, particularly if you're expecting or planning on having children as well. So it was a safety thing in Scandinavia.
yeah,
And then, oh yeah, it also has an environmental benefit. We brought it in on the environmental benefit. And
yeah.
oh, by the way, this actually reduces workplace exposure as well. So yeah, we were first to bring it into the UK, and since then that has grown, and it's grown throughout the world as well as a technology that can be used where this pain relief is still required. Yeah. So we had a little hand in that,
No, I think
definitely.
that's fantastic. Well, the two of us could talk for hours on sustainability, but unfortunately, we have to draw this to a close at some point. So I think we've covered a huge amount of ground. I think James has told us a fantastic story. So just leaves me to say thank you, James, for joining us.
No problem, Gareth. Thanks for having me.